Hi everyone, I am starting a series on cardiac clues from physical appearance. Coming to our first topic is skin. What are the skin appearances in cardiac clues from physical appearance? So first cyanosis. Cyanosis is a bluish or purple discoloration of skin or mucous membrane. Usually there is a decrease at least 5 mg per dl of hemoglobin in surface capillaries, but occasionally due to abnormal hemoglobin such as sulfamate hemoglobin. You can see here is a bluish discoloration of skin and mucous membrane of hands. How can you distinguish from central and peripheral cyanosis clinically? So central cyanosis is seen in warm as well as cold areas. We have to compare with the normal patient. In African American patients, evidence of central cyanosis may be seen in conjunctiva also. In definitive central cyanosis, it is not usually recognized unless the arterial oxygen saturation is below 80%. Peripheral cyanosis is seen only in cool areas such as nail beds, nose, cheeks and earlobes and outer surface of lips, where the flow is decreases the amount of hemoglobin in the surface capillaries. If clubbing is present or hands are warm, cyanosis is probably central. How should you test for the mild clubbing? So the clubbing, look for the obliteration, normal angle between base of nail and proximal skin. So approach the nail bed from the behind and feel the edge of the nail root floating free, like nail root is floating free when the distal portion of the nail is depressed with the another finger. So what can cause the clubbing besides the cyanotic heart disease? So other causes like hypertrophic osteoarthropathy as cancer of lung or infective endocarditis and severe ulcerative colitis also cause the clubbing apart from the heart diseases. So cancer of lung is the most common cause of painful clubbing. So what is the differential cyanosis and what is its significance? So differential cyanosis means that the finger are pink but toes are cyanotic. So it signifies presence of persistent ductus arteriosus PDA with a reverse right to left shunts due to pulmonary hypertension like Ishermander syndrome. So left hand may also be cyanotic because ductus may be located at the branching part of left subclavian artery. What are the skin signs secondary to the small emboli of infective endocarditis? So we can see the clubbing in infective endocarditis and the splinter hemorrhages of nail. Osseous nodules like painful. Osseous nodules are painful and tender and reddish brown raised areas up to 3 to 15 mm in diameter. Occasionally white is in center on palms and soles. What are the Janeway lesions? Painless and circular or oval pink to tan macules about 5 mm in diameter on the palms and soles that do not branch with pressure. You can see here these are the osseous nodules and these are the Janeway nodules. Osseous nodules and Janeway lesions. So what are the cardiac conditions is suggested by the brownish and muddy pigmentation of skin and signs of hepatic failure, such as loss of axillary and pubic hair. So hemochromatosis with cardiomyopathy due to intracellular iron deposition, heart muscle with secondary intestinal fibrosis. So when amyloid disease with cardiac involvement cause skin lesions, what kind of lesions? So when the primary, if it is primary or secondary to the multiple myeloma, or if not, it is a secondary infection. So yellowish brown papules or nodules or packs may develop, often pruritic with signs of bleeding due to the scratching. So these are the amyloid with cardiac involvement cause the skin lesions. What is livedo reticularis? What is significance? So terms indicates marbling reticulation or fishnet type of mottling of lower trunk and buttocks and extremities, frustrated or exacerbated by the cold or emotional upsets. It occurs about 20% of patients with lupus erythematosus and periarthritis nodosa or cryoglobulinemia. It has occurred recently in man over 50 years of age. If suggests cholesterol embolization from the abdominal aortic aneurysm, these are the cardiac condition. What are the cutaneous manifestations of intestinal carcinoid disease? What is the cardiac manifestations? What are the cardiac manifestations? The face and neck may show the various blends of red and purple, often patchy and mottled. If the disease has been present in long time, so telangiectasia may be present. So as the may pulmonary and tricuspid stenosis and regurgitations caused by the fibrosis of the valve structures. What diagnosis can be made by noting facial flushing following by syncopal attack? So cardiac arrest or stroke attacks which cause the facial flushing. So flush probably manifestations of total body reactive to hyperemia as follows the temporary cessation of the circulation. What condition that can affect the heart besides the thyrotoxicosis can cause the warmer than average skin? So like severe anemia or beer drinkers or acute beriberi, which can affect the heart besides the toxicosis, can cause the warmer than the average skin. So what kind of conditions are suggested by the cold hands and feet? So if hands and feet are moist, they suggest anxiety, may explain the chest pain and palpitations and fatigue seen in neurocirculatory asthenia like Takostas syndromes. So if only feet are cold, the patient has a history of intermittent claudication or peripheral arterial obstruction with poor collateral circulation is suggested. If cold extremities are relatively recent in onset, so a week or few years, output state is suggested. So what are the skin signs of pheochromocytoma of adrenal? So like we can see the neurofibromatosis and capsuloid spots and axillary flaking like flow signs. These are the physical appearance of cardiac clues, cardiac clues of skin lesions. These are the cardiac clues from physical appearance, skin lesions.